Welcome to It's Your Health, and I am here with my groom, Philip Benyo, and we hope that we'll answer a lot of your questions that you may have dealing with mostly medical issues.
Well groomed at that. Hello out there in television land. Welcome to It's Your Health. We're your leader in healthcare information. Make sure you check with your healthcare provider before doing any of the things that she talks about here on It's Your Health.
I thought he wanted me to do all of this.
We'll be right back.
Took right over.
Okay. Welcome to the first segment of It's Your Health. I'm with my bride. Me being the groom, I guess, right?
Right.
And, you know, before we start, I have to say something that as I'm getting older, I don't know if people out there feel the same way, but you start reflecting on things that happened to you many, many years ago. You know, you think about things in the past. And one of my fondest memories is when I first came to town some 35 years ago, and I started working at the then St. Joseph's Hospital. Okay. We started an ambulatory care center, and we started satellites throughout the area.
I remember that.
And we went down to Shenandoah and changed a Kresge's Five and Dime into a healthcare center. And I'm telling you, if there's anybody that can live the motto of eat, drink, and be merry, it's the people down there. I really loved the time we were down there, fondness for Shenandoah, because I kind of got my beginnings down there. So hello out there to Shenandoah and Schuylkill County. Thanks for watching.
Are you ready to start working now?
Yeah, I've stopped reminiscing.
Okay. Okay. I thought you would talk about their kielbasa.
Oh, I'll tell you what. Yes, as a matter of fact, I entered their kielbasa contest a couple of times. And I haven't because I lost my partner, Mike, to Lou Gehrig's disease a few years ago, and I just haven't had the heart to get back into it, but I will. Okay,
let's start with this. I'm going to start with headlines that are really questions. So I'm going to be quizzing you.
Oh, okay.
This person wants to know that her husband is constantly craving salt. Is this a symptom of Addison's disease?
Rare disease, Addison's disease. It's a failure of the adrenal glands, and as a result, you may have low blood pressure, weight loss, nausea, feeling ill, and crave salt. Usually, it's not that illness. Usually, salt craving is just our American diet, which you probably should avoid the salt anyway, because there's enough salt in the food to begin with.
Mm-hmm. There's even salt in the dog food.
Really?
Yeah.
Wow.
Okay, next question. Can exercise prevent memory loss, and can it improve cognitive functioning?
The latest series of research articles suggest yes. Exercise is your best friend for almost any illness. And if you don't use it, you lose it. So, I mean, you don't have to have the type of exercise where you go out to the gym and knock yourself out. They're actually suggesting now that the more sane form of exercise is to do something perhaps on a every other day basis, a little strenuous, and you take a day off. And that seems to be the best thing to do, is don't knock yourself out.
Walking the dog is a good thing.
Yes, that is a great exercise.
Chasing the dog through the field is not as good a thing.
It's a good exercise for him. He will not get Alzheimer's, I'm sure.
Okay, next question. Is there a connection between menopause, no smart remarks please,
Not me,
and high blood pressure?
Yes, as a matter of fact, women who go through menopause, they start getting male risk factors, of which hypertension, high cholesterol is one of them, and weight gain, by the way. And so
boy, do I know that.
They will have hypertension. It may be one of the most common diagnoses in postmenopausal women. Keep in mind, it does not cause symptoms until it's too late. So get your blood pressure checked. And hypertension, unfortunately, is one of our most underdiagnosed and undertreated diseases out there. So get it checked. It's a very simple thing.
Can you use one of those ones that you buy, you know, at the drugstore?
I found those to be very accurate. In fact, when I say to patients, listen, you have high blood pressure and you don't live in my office, you live at home, why don't you pick up a blood pressure monitor? They're only a couple of bucks, and bring it in. We'll show you how to use it and make sure it's accurate.
Oh.
Because let's face it, we want to know what their blood pressure is at home, at work and play, and not necessarily in the office. So yes, they should.
But some people have white coat syndrome too.
Exactly. Yeah, my mother was that way. She had normal blood pressure, but then when she came with the blood pressure cuff, it went up for some reason.
Well, I tend to have that also.
Oh, well, I'm not wearing a white coat, so
Oh, so
that's
we're
why.
okay.
We're all right.
All right. Next one is a headline, so you're off the hook a little bit. Healthy gums are firm and pale pink and fit snugly around your teeth. Signs and symptoms of periodontitis.
Close. Periodontitis, yeah, sure.
There are symptoms that can include various things that lead to more serious problems.
Right, we talk about medicine in general, but one area that really is sometimes neglected, particularly in our elderly, is their dental health. And it's very important that you, like routine gynecology exams and routine mammograms, get to see your dentist, because there's no doubt that dental issues can lead to more systemic things that can affect your heart, mind, and body. So without question, just like your car gets an annual inspection, you should keep up to date on your dental care.
Yeah, even more than annually, maybe twice a year. It can cause tooth loss, which the disease or the infection will enter your bloodstream, affecting your heart, lungs, and other parts of your body.
Right, so it's very important.
So we want to keep a nice smile on everyone's face.
Absolutely.
Next, the 7 anti-aging foods for your skin.
I found this fascinating. If you look at your screen, as we say in the business, the full screen, you'll find 7 anti-aging foods for your skin. Briefly, oats. Oats are complex carbohydrates, and they're low glycemic, which is great for your sugar. Oranges, loaded with water. Avocados has a healthy type of fat. Lean beef, I like that one. It doesn't say bacon, but Brussels sprouts. You know I love Brussels sprouts, and I make them weekly.
With bacon.
With bacon. And salmon. Salmon is high in omega-3 fatty acids. And grapes. Grapes have that resveratrol, I think. I'd prefer the wine, to be honest with you, but grapes are just as good as well. So we told you this is the fastest half hour in television history, and we've shown it to be true, because we're taking our first break. We'll be right back. You're watching It's Your Health. We're your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. I'm here with my bride, bringing you the latest and greatest in healthcare information.
And some very interesting headlines. Not that they're not always interesting, but these especially.
Handpicked.
By you, I might add. Why having sex keeps you happy. We already know that simply being married can give you a health boost.
Marriage is not simple, but go ahead.
But researchers now say the ring alone may not do the trick.
Well, that's sort of in the eat, drink, and be merry part of our lives. To me, that's a no-brainer. I think if you have a active, intimate relationship, that will carry through to all parts of your life. Don't you agree?
Oh, absolutely. Whatever you say.
There it is.
No question about it.
Moving right along.
Moving right along. How to banish a bad mood. That goes back to the first.
Go back to the first question.
Line, yeah.
Have some sex, and that'll keep you happy. But tell us more about a bad mood.
If you're in a foul mood, don't just wait for the cloud to pass. Researchers are getting closer to learning how we can order up happiness when we need it. Try some of these scientifically proven tips.
Such as exercise, take a hike.
Oh, always exercise, yeah. Write a thank you note
Huh, that's very positive.
and do a good deed. Do something nice for someone else.
I agree. Random acts of kindness, that goes a long way. You know, I have this theory that there's a seat in our head that is always occupied, and it's a worry, anxious type of seat.
I can agree with that.
And you really need to do mind exercises, if you will, to try to get you off that and replace it by something else. And doing random acts of kindness, exercise, eat, drink, and be merry is one way of doing that.
Yeah, yesterday I had someone on that seat for
Oh,
me.
really?
Yeah, it was not good.
Yeah, it's not a good place to be, and it affects you. You know, your blood pressure goes up, your pulse goes up, you're in a bad mood, but these things can be changed. The mind's very powerful.
Absolutely. And moving on now to niacin. Niacin can boost good cholesterol. It's a B vitamin that may raise your good cholesterol, but side effects might outweigh benefits for some people.
Yeah, niacin is, I think it's B3, and it can change your cholesterol pattern, lower the bad, but more importantly, raise the good. It's a tough vitamin to take because it causes flushing. A lot of people don't like that feeling. But I think it's something you can add on to your regimen. B vitamins I like because they don't accumulate in your body. You kind of pee them out if you don't need them.
Oh, well, that's good. And they do increase your risk of high blood sugar levels, infection, liver damage, stroke, and bleeding if you take too much of it. So if you're planning on taking niacin, or if you are taking it, bring it in and talk to your doctor and make sure that you're taking the right dose.
Yeah, a little goes a long way. You know, too much of a good thing is no good
Oh, really?
for certain
I've heard
things.
too much of a good thing is wonderful.
Oh, okay.
Moles and skin cancer. This is something that as women are supposed to monthly check their breasts, we should regularly check our bodies.
Absolutely. And there is a nice ABC of looking at a mole.
DE.
And keep an eye on that. Look at your full screen, as we say in the business. And get a load of that. Asymmetry, if one half the mole does not match the other half. B, if the border or edges are ragged, blurred, or irregular. C for color. If it has different colors, that's a concern. D
You
for...
mean if the mole itself has different colors?
Yes, that's a bad sign. D stands for diameter. The diameter of the mole is larger than the eraser of a pencil. And if it's evolving, E, if it's getting bigger, that's of concern as well. And so I think that if you have a mole that's concerning, I would have it looked at and get it removed. As we say, when in doubt, take it out.
And check once a month.
Yes, yeah, especially since we're getting into the sunbathing season.
And into the tick season. Oh, I hate those ticks.
They really, you mentioned something earlier saying, you know, the Lord has put things on our planet that have certain values that have...
There's a reason they're there.
So why did he put ticks here?
I still can't find a good reason for them.
No good reason. I just picked two off me yesterday, so
Yep.
they're out there.
That's for sure. Speaking, we were just talking about checking your body. Now let's talk about a breast lump when you check your breasts. If you find a breast lump or other change in your breast, you might worry about breast cancer. Remember that breast lumps are common. Most often they're benign, particularly in younger women. But no matter how old you are, it's important to have any breast lump evaluated by a doctor, especially if it's new and feels different from your surrounding breast tissue.
There's no doubt. And one of the things that is common out there, the belief is that, well, I'll go for a mammogram, and if it's negative, I don't have to worry. Not so. 1 in 10 mammograms may not necessarily be accurate. So the point is, if you have a lump, I don't care what your mammogram shows, if you have a lump, you got to track it down. You got to see a breast specialist, have it evaluated, maybe drained, needled, or removed. So despite a normal mammogram, if you have a breast lump, you have to act on that, which is why we do breast exams in the office. People say, well, just give me a thing, I'll get a mammogram. I don't want you to check my breast. That's fine. But you can't rely on the mammogram entirely. You need a clinical breast exam. And if there's a lump there, I don't care what the mammogram shows, you got to go after it.
And it's a scary thing. I know for me, when I had that problem, you know, you have to go through and see the doctors and wonder what they're going to find and what the prognosis is. And it's, you know, it's a lot to think about.
Well, it's unnerving, but, you know, it always perplexed me why we can't find breast cancer earlier. I mean, the breasts are out there, we can feel them, we can do mammograms, we can do ultrasounds, so don't ignore it.
Gotcha. Should you do an ultrasound when you get your mammogram?
Not always. The ultrasound is used for further defining something that might come up on a mammogram. And if I could wave a magic wand, I would say we shouldn't even do mammograms, we should be doing MRIs. MRIs of the breast would probably be your best bet, and maybe one of these days we will.
And we have more to talk about, but no time.
No time. It is the fastest half hour. We're going to be right back for our final segment of It's Your Health. Don't change that dial. We'll be right back. You're listening to It's Your Health, your leader in healthcare information.
Welcome back to the third and final segment of It's Your Health, and it does go so quickly. I do want to give a shout out to Samsung Productions and tell you that if you're missing our show, try their app. It's available in the applications section of your phone or whatever you use, and it's a great app. It's got all the shows on it and all the information, the community events, the news, everything you might need to see is on that app. So take a minute, get your phone, and install that app on your phone.
Is that for free?
Yeah, it's
Wow,
free.
I like free.
You have absolutely. So let's talk now. Now anybody, anywhere can watch us.
Worldwide.
How about that? Okay, we'll get back to our business of talking about being healthy. Prostate cancer. Here's a question. Is it true that pomegranate juice may slow the growth of prostate cancer?
You know, I heard that.
Pomegranate juice.
I heard that, and I'm not so sure about that one. I'm not so sure I would put my life in the hands of a vitamin supplement like that. It certainly can't hurt. Prostate cancer, of course, is very common in men. And that's another thing that, just like breast cancer, we should be able to pick up and find through both a rectal exam and the PSA, which is kind of controversial, I'll admit, but nevertheless.
What is PSA?
The PSA stands for prostate-specific antigen. It will go up as your prostate enlarges.
Is it a blood test?
It's a blood test. But we've found it useful to detect people out there who actually had normal exams and had elevated PSAs. We sent them on to biopsy, and they came back positive. So they found an early, curable, treatable prostate cancer. So, and it is a little controversial because if your PSA is up, the concern is you go for a biopsy that you didn't need to begin with that has side effects. So I think you just kind of have to treat the whole patient, see a specialist, and go from there.
Well, that's what happened with my brother. He felt perfectly healthy, and when he went to get his regular checkup, his PSA was elevated, and he was suffering from prostate cancer. And they caught it in time because of that blood test.
Yep. It runs in families, by the way, so something you don't have to worry about, but nevertheless, it does run in families.
Good to know. Diet soft drink intake tied to stroke and dementia risk. That's interesting. Artificially sweetened soft drinks like diet soda are associated with increased risk for stroke and dementia, according to an observational study.
Yeah, that's a little concerning. You really can't beat sugar, let's face it. But nevertheless, the use and perhaps overuse of these diet sodas. Some of them get into the blood-brain barrier, and God knows what they're doing. It is a chemical. We're not sure what it's actually getting metabolized to or the side effects of it. And let's face it, we grew up as humans not having these artificial chemicals. So if you can avoid it, I would.
Okay, so I can go back to my Coke.
Yes, good old-fashioned fructose. Yes.
Absolutely.
Corn syrup.
I saw the Coke that you just bought.
Yes.
It says Philip on it.
That means it's mine, by the way. That doesn't mean it's yours.
But the other one that he bought says Carlos. So whose is that?
That's my girlfriend. Don't tell anybody.
Your girlfriend? Okay. Well, that'll be mine.
All right, you can have it.
Nutrition and healthy eating. If you're looking for a heart-healthy eating plan, the Mediterranean diet might be right for you. It incorporates the basics of healthy eating, plus a splash of flavorful olive oil, your favorite, and perhaps a glass of red wine, also your favorite, among other components characterizing the traditional cooking style of countries bordering the Mediterranean Sea.
You know, even though I have some Slovak and Irish genes, I really think I am a born-again Italian because I love the Mediterranean diet. Who can give up, you know, things like pasta, garlic, olive oil, all those great dishes, the fish, the wine, and it follows true because my cholesterol's virtually normal, and that's sort of the diet that I follow, and you should too out there. Mediterranean diet, you can't go wrong.
A pass on the butter, it says.
Yeah, well, I would use olive oil.
And extra virgin olive oil is what you want.
Right, and you know, don't get the real expensive stuff. I'll tell you why, because that sits on the shelf because nobody buys it, and it turns rancid.
Ooh.
So, you know, get a quality one that's a little inexpensive because the turnover is quicker and you won't get rancid
Well,
olive
that's
oil.
interesting. I also read that light olive oil isn't really to your benefit, that it's mixed with other oils.
Yeah, they tend to blend them, you're right. But you don't spend a lot of time in the kitchen, do you? How would you know about these things?
I read.
You know, for Mother's Day, I have to be honest, okay? This is a show of...
You don't have to be honest.
For Mother's Day, she said, will you please take me where I've never been before? So I took her into the kitchen, and so that was your Mother's Day present. All right, thought I'd just throw that out there.
Oh, just wait till you get home.
All right.
Next one. This is a good question because I feel like I need a lot of sleep, but how many hours of sleep are enough for good health? The amount of sleep you need depends on various factors, especially your age. While sleep needs vary significantly among individuals, here are some general guidelines for different age groups.
I think we're sleep deprived as a nation, particularly our youth. You know, they're up playing video games, which is bad to begin with because you kind of get your brain excited when it should be winding down. But get a load of this chart, you'll see...
Is it a full screen?
It's a full screen.
Okay.
Get a load of the age group. We go from newborns to adults. And I don't think there's many adults out there that are getting 7 to 9 hours of sleep, and much less our teenagers. 10 hours, you're kidding me? But I think it's crucial, and I think it is something you need to pay attention to.
A teenager who has to go to school early would have to be in bed at 8 o'clock at night in order to get the 10 hours of sleep.
Good luck with that.
Yeah, that just, good luck with that is a better answer. Okay, here's another question. I'll tell you a little bit and then you can expound on it. Does caffeine help with weight loss? Caffeine may slightly boost weight loss or prevent weight gain, but there's no sound evidence that increased caffeine consumption results in significant or permanent weight loss.
Well, caffeine got a bad rep a while back, but it's made a resurgence, and it can be an appetite suppressant. It can increase your metabolism. They've had studies that say maybe it prevents Alzheimer's and those type of things. So I think a little bit of caffeine, getting into that area of everything in moderation, is not a bad idea. So you can have your Coke.
Yeah, well, you have to think that the Coke has all that sugar in it, and sugar will help you gain weight, not lose weight.
Right.
So that's something that has to be taken into consideration.
You're back to walking the dog.
Back to walking the dog, yep.
And believe it or not, here it is again, our fastest half hour. So
Time's up already?
time's up
I
already.
have more.
I know we have more. You're just going to have to tune in next time because we'll save the good stuff for our next visit. Thank you again for allowing us to come into your house, inform, and hopefully entertain you. Remember, you're watching It's Your Health. It's Your Health.
That's better.
I need my caffeine. Your leader in healthcare information. Thank you for joining us.
Thank you.